Hello, everyone. Hi. Welcome to the NeuroNest talk. And I hope this one is going to be interesting and special because we have something cool to show. But before we do, let me warmly welcome our two panelists, Agnieszka Hyla-Pochrzęst, delivery lead in Netguru Healthcare. Hi, Aga. A second ago, leading now in a form of a panelist. And Marcin Oziemski, engineering lead for health tech at Netguru as well.
Hello.
So before we dive into our chat, we would like to use this opportunity to showcase a prototype of a digital therapeutic platform, NeuroNest, that we have developed for those suffering from the Alzheimer disease. And I think it's important to mention that while we don't have experience in Alzheimer care and nor we intend to be the experts, over the past few years we have been working on developing digital products for the health tech domain. So with NeuroNest, we would like to do two things. One, hopefully positively contribute to the development in the space. And two, spark, hopefully, a fruitful discussion on the how to build digital products in health tech. So before we jump into this discussion, let's meet NeuroNest.
5 million people have dementia worldwide. Alzheimer's disease may contribute to 60-70% of cases. It's almost 38 million. How about we could make caring for a loved one with Alzheimer's disease just a little bit easier? Meet NeuroNest, our digital therapeutic platform for Alzheimer's care, uniting patients, caregivers, and medical professionals. With the NeuroNest mobile app, as a caregiver, you have access to advanced technology to enhance the care for your loved ones. The health tracker contains information about your loved one's treatment plan, including medications and diet set up by their doctor. NeuroNest allows you to integrate data from wearables such as Apple Health Kit. Thanks to this, you have a holistic view of their health and can provide valuable insights to healthcare providers. Our 24/7 AI assistant is designed for privacy and data security, while providing complete control. You select information chatbot can use, putting you in charge of what is shared and what's not. Lastly, according to the Alzheimer's Association, memory loss is one of the 10 early signs of Alzheimer's disease. That's why the Brain Train module offers a variety of engaging games and activities designed to enhance cognitive function and memory retention. The simplified screen is adjusted to the cognitive abilities of the individual suffering from Alzheimer. You can set it as a default for your loved one. Playing games can be an excellent way to improve brain function and mental health. Our app carefully measures statistics, which are automatically shared with the doctor to help them monitor your loved one's cognitive health. Lastly, the NeuroNest app's AI assistant has been enhanced with the latest ChatGPT technology. This addition to our app enables more personalized and natural conversations, simplifying the process of getting support for daily tasks. The NeuroNest represents a concept of a comprehensive, scalable, digital therapeutic platform. It has the potential to enhance the lives of the individuals affected by Alzheimer's disease and their loved ones. NeuroNest, redefining Alzheimer's care.
Okay, so Aga, Marcin, I know that you have developed the prototype together with the team, of course, from the concept to design and implementation in just under 6 weeks. And, when we talk about the health tech space, we know that there are certain inherent limitations to this domain itself. So let's draw on your experience and also on the learnings from the NeuroNest work on the prototype and zoom out a little bit to talk about the hows. So let's try to answer the question, how do we build digital products for health tech? Why and how is that different?
It's like Radek Zaleski mentioned in his opening speech today. 10 years ago, patients, doctors, medical personnel, we were all used to the fact that everything in healthcare is paper-based. And then COVID came and proved us all slightly wrong, at least, by showing and forcing us to move away from the traditional offline therapy and onto the digital, at least partially, and in some cases fully digitalized healthcare world. So when we are thinking about medical digital products, we need to speak about two pillars. The first pillar is just a classic software delivery and digital products delivery approach with all of the best practices in mind, particularly in regards to the quality, to design and accessibility, data protection, and technological innovations. But then this first pillar has to be adjusted to the second one. So the fact that we're dealing with healthcare, which is very documentation and regulatory heavy. And what comes out of the collision of the two worlds are these amazing ideas that we currently observe on the market.
Right. So this is on the general note. So if you can tell us a little bit, what do we begin with? How do we begin?
I'd say it's important to begin with idea validation. Every startupper within the digital world will tell you that, but health tech products, digital products tend to be more expensive, even by 40, 50% than within the other areas of digital world. So it's very important to validate the idea well before we invest too much. You can validate it based on just initial idea description, mind maps, mock-ups and wireframes, and then designs, but it's very important to be patient-centric here. So the most important thing with digital health is to think about the user's perspective, because the patients, the doctors, the nurses, they are going to be the users of the future system. So we basically feedback the application, the final solution at every single stage. We can also build a prototype, which brings immense value to the final product, like the NeuroNest that we have built. We had 3 user groups. The patients, the Alzheimer's patients, their caregivers, our key user group, and the doctors. And each group differs slightly in the use of the application. For example, when we validated the prototype initially, the first thing that we have heard from the caregivers was that the application was too complex for patient with any kind of dementia. So this is how the simplified view for the patients was created, and that changed the concept completely. And some ideas end up being executed in an entirely different way that was originally planned, but they still serve the same purpose and the same goals.
Great. I have one more topic I would like to touch upon with you, Aga, and then Marcin, we are over to you. So, adoption in digital health is a challenge in itself for many different reasons. So what about accessibility?
It's very good that you're asking about that, because we need to be considering a built-in accessibility approach here. A friend told me a very good comparison lately, that when you bake a blueberry muffin, you can't really add blueberries after you bake the muffin. And that's very true. You can try, but it's very costly and time-consuming, and the result won't be as satisfactory as in case of the built-in accessibility. So, as we don't really speak about accessibility in regards of regulatory must-have, in practice, it really is a must-have, because all of health tech products must be accessible to all. And while in case of other digital areas, we mostly design products with a user from the middle of the curve in mind, so just a standard user. But here in health tech, we need to be thinking about the edge cases, the people who are sick, tired, overworked, with disabilities, sometimes all of the above at the same time. So we focus on the users that are going to be struggling with traditional platforms. And the most common guidelines for accessibility is the WCAG AA standard, or the higher one, but the higher one is sometimes impossible to achieve.
Thank you, Aga. And having all of that in mind and, looking at NeuroNest, a prototype in under 6 weeks, Marcin, how does it all translate into technology? What should one be aware of? What's the T?
Okay, so I think that we need to start from, client-centric approach, right? So we need to think how to actually deliver client-specific therapy. And for that, we need data, right? So it can be like in the 10 years ago that we went to the doctor on some laboratory for blood tests one every year or a half year. Right now, we have a lot of tools that actually can gather our data 24/7. And we already showed that on our POC, that we actually connected the wearables to our POC, and it's actually, the technology is there. We can just grab it, go with connect to our applications, to our systems, and actually it will be harnessing things like sleep data, the heart rate, or any activities. And that's actually one of 4 main areas in data. Like, we need to have that data from somewhere, right? So we actually can do it easily with this sensors, wearables, with our smartwatches that we wear every day. But there is a lot more. With each year, actually, the sensors getting better and better, the chemical one and a lot of others. And with enhancement of AI in that area, it's actually like enormous possibilities. But okay, we have first things to actually gather the data, but we need to actually usually share them, right? Easily share them. So in our POC, we actually thought, okay, so what's there on the market? How we actually can share the EHR, so electronic health records, easily between the systems, between, I don't know, even your smartphone and system backend. So there is a FHIR, so fast healthcare interoperability resources. And this standard actually is widely accepted by Apple, like Health Data Services, or any other main cloud providers like AWS, Azure, or GCP. And so we have the data, we collected it, we can share it, but then if you want to share data, if you want to store data, you need to be sure that it's secure, right? So we looked what's the best tool that's already there, because it's not only about, you know, having the cutting edge of technology. If you are presenting it in a half year, you need to do it quickly to validate your idea, to validate your business. So we actually checked by our clients, so mainly on the enterprise side, what cloud providers they are using, and they are using Azure mainly. And in Azure, you have Azure FHR cloud service, Fire service, which is actually what we need. There's already database and API, so it's easy to plug and play and just use in your system. And the last thing is actually visualization. So you need to have that data, but you need to, you know, use it somehow, right? So to visualize the data, for example, for the doctors, for the practitioners in Azure, you can use Power BI, which is super powerful tool for visualizing data, making custom dashboards, and so on. So with all of this, you can easily connect, harness the data, share them securely, and visualize them with powerful tool.
Thank you, Marcin. And, you know, I have this one question that keeps popping in my mind, but I realize that with asking it, we will just scratch the surface, but I feel like I have to. What about medical device regulation? You know, we are talking about developing digital products in health tech. So very briefly, without going into the specifics, do we always have to certify?
Well, fortunately, we don't. The difference lies within the purpose of the system and within type of data and what happens to the data within the application. What's important to remember is that the analysis needs to come first. So you need to make the effort to analyze whether the application, the system, the platform is going to need to be a medical device. And if it does, get yourself an external consultant with knowledge and experience, and keep in mind that the very important topics are the local government regulations, like, for example, in United Europe, we have the medical device regulation, but also each country has their own regulations, which tend to be more strict. And then we focus on quality, on risk management, and on data protection, and of course, accessibility, like I've already mentioned. And, you know, like in traditional healthcare systems, there is a lot of wait time. So we'll be waiting for decisions, for information.
Be ready to be patient.
Yeah, exactly. We need to be patient. Thank you.
Marcin, over to you for just a last one comment. If you were to give one advice to somebody who is about to launch a product, what would it be?
So I will repeat myself, sorry, about the data. So what data do you need? How to collect it, how to store it securely, and how do you want to visualize it, use it afterwards? So that's it for me.
Thank you so much, Marcin and Aga. It was a pleasure.
Thank you.